So now our keynote presenter today is Ms. Tsunekawa. She's from JETRO London. She is a life science specialist. Japan is one of the top runner of aging population, and she will talk about health and elderly care in Japan. Ms. Tsunekawa, the stage is yours.
Thank you very much. I'm trying to share my slides. I hope you can all see it. And thank you very much for the introduction. My name is Keiko Tsunekawa, and I work as a life science specialist, and I'm based in JETRO London office. My aim this morning is really to provide a quick snapshot and the overview of the landscape of the health and elderly care and the systems that are currently in place in Japan. I'll cover these topics on the screen, and if you have any questions, please do ask and send by chat. And this is the basic data of the country of Japan. We have the population about 125 million people living in the area, which is similar to the size of Germany. We have one of the highest average life expectancy, which is 84 years old globally. And our country is divided into 47 prefectures, each of which is led by the governor. Elected governor. The total GDP is ranked at the third largest globally after USA and China. The most pressing issues in Japan at the moment is with this large social implication are aging population and the gradually declining birth rate. In the graph, the shade of the green, two shades of the green shows the population of which is 65 years old and older. And as you can see, it was 7% in 1970, and it's gradually and rapidly actually increased to nearly 30%, 28% right now in 2020. And the total fertility rate, which is the average number of children a woman has for life, is decreasing about over 2 in 1970 to 1.42 last year. This means that we started to see a gradual reduction of the population and a rapid increase of the elderly population. The graph that I'm going to show you now, it shows the elderly population, which is over 65 years old, in Germany in blue line and the orange, Japan in orange line. As you can see, Japan took the Germany over in mid-90s and running very fast since then. We expect a particular problem in a few years' time, which is called 2025 problem, which is here, when the baby boom population who were born after the war, World War II, reached 75 years old. And that is the time when the population of the elderly population reached 30% of the total population. These graphs show that we know in Japan the average of between 9 and 13 years of life, especially toward the end of our lives, spent with some sort of disabilities and diseases, which prevent people from having full life towards the end. This places a lot of impact on themselves and on the society, but also on the lives of the family and families and carers. Therefore, increasing the healthy life expectancy, not only the average life expectancy, towards the end of our lives is a top policy priority. In terms of the cause of death, they are dominated by cancers, accounting for about 27% of all death, followed by heart diseases. The death due to the cerebrovascular diseases is decreasing, mainly due to the improvement of the emergency treatment. The box in the right-hand side shows the number of people with chronic illnesses. As you can see, hypertension and diabetics are the main chronic diseases that needs to be managed well. Among the elderly population, the number of people with dementia is increasing, and it is expected that nearly 7 million people will have dementia by 2025. And on the graph on the right-hand side shows the increase of the number of households occupied by only with the elderly people. So this probably help you imagine the kind of changes that are happening at the community level in Japan. Moving on to the health system that are in place now, the Japanese healthcare system is based on the national healthcare insurance. Everybody in the country pay a contribution towards the insurance scheme. If you are employed through the employers, their families, through the head of the household, they pay through employers. Those who are not employed or self-employed through the local government. And the amount of contributions people pay are based on the income level. When you get sick, you can go to a clinic or hospital of your choice and receive necessary treatment. And there are some co-payments occurring at the time of receiving treatment. Doctors can prescribe medicines and procedures that are included in the reimbursement list. And in principle, they cannot mix private and reimbursable procedures and treatment. Therefore, in theory, you get similar treatment wherever patients go to. Hospitals and clinics then send the bills to the insurance associations via the third body that assesses the appropriateness of the treatment. And this health insurance cover treatments, but preventions are largely implemented through different schemes outside of this health insurance scheme. And who pays for the healthcare services? I put the pie chart here. About a quarter of the total healthcare is paid through the central government, and employees is bearing 28%. The patient out of pocket is 12%, employers 20%, and the local government also contribute. And we know that the expenditure for health for the elderly, which is for 65 years old and elder, is over 4 times as much as the rest of the population. Therefore, we really need to make an effort to reduce the cost of healthcare treatments, especially for the elderly. Therefore, improving the healthy life years is a top priority again. In Japan, we have about over 8,000 hospitals and 100,000 medical clinics. Clinics are the ones that have less than 20 beds in their facilities, and hospitals are those which have more than 20 beds. And I highlighted here, I'm not going to explain all the indicators on the table here, but I highlighted some of the differences between Japan and maybe Germany or other Western countries. Sorry about this flipping. So in Japan, we have lower number of doctors per population ratio, but we have other resources such as higher number of resources such as number of beds and CT and MRI scanning facilities and machines. And you may be surprised how long the hospital stay is in Japan. In terms of the elder care insurance, this is a summary. And what happens is when we become 40 years old, we start paying the insurance fees, contributions. And the insurance is managed mainly by the local administrations, such as cities and towns. And those who are 65 years old and older, whose need for the care are approved by the local government can receive the services or utilize the services. But then there will be some process of approval of the level of care people need. Co-payment will happen, and depending on what they receive, between 10% and 30% of the services that they utilize. The philosophy of this framework for the elderly care is that it encourages independent living, emphasis on prevention and community-based care. Unlike the health care, this elderly care insurance encourages or approves of non-insured services. So a mixture of private and public services are allowed. This is about healthcare expenditure, or in turn, the size of the medical market in Japan. 43 trillion yen in 2018 was spent via this health insurance framework, of which about 9 to 10 trillion yen is estimated to be spent on drugs. And out of 43 total healthcare expenditure, 2 to 3 trillion yen is estimated to be spent on medical devices. These actually constitute much of the healthcare market in Japan. Most of the large medical or large branded pharmaceutical and medical device companies penetrate their market shares within this healthcare insurance framework. Elderly care insurance expenditure was about 10 trillion yen, and we expect this to increase. The healthcare market does exist, but the size of it is a lot smaller than the market that is covered by the health insurance scheme. This is my last slide, but I would like to highlight a few latest developments in Japan. The current pandemic has definitely accelerated the digital transformation. It is about using digital technology more like strategically in the business and maybe symbiotically with other technology that they already have. It is often required to present solutions to big social issues such as aging and declining birth rate. And COVID-19 also prompted the government to start to allow online consultation for the first consultation between patient and doctors. Previously, it was quite restrictive what the online consultation can be used for. The second example would be digital therapeutics. This year, the first digital therapeutic application or software was approved by the regulatory authority, and it is expected to be included in the reimbursement list. That's a digital tool to treat nicotine dependency. The integration of IT into healthcare is another recent development. The Japanese government has an ambition to build AI hospitals, and the first drug is also developed using AI, is under the clinical trial at the moment. Diagnostic imaging using AI was approved for analyzing CT scan of the patient's lungs to facilitate early diagnosis of COVID-19. Automation is also happening gradually, or continuous manufacturing of drugs have been happening in Japan also. Now, at the moment, I think 4 to 5 drugs have this continuous manufacturing in the process, and the regulatory authority has approved of that. Lastly, but perhaps unique to Japan, is the large large corporations that are traditionally not in the health market or pharmaceutical market are starting to enter the health market. So, for example, Fujifilm was making X-ray films before, but now has a large presence in drug development and bio businesses or therapeutic businesses, therapeutic development businesses. Another example would be telecom giant NTT has started a validation project in telemedicine. Another one probably would be a large social media company called Line. tied up with another medical information outlet, which was a small outlet, but by combining these two, they are creating a large platform for medical professionals to receive professional experts' information. So there are quite a lot of examples of large corporation, not health pharmaceutical companies entering market or diversifying their businesses. So those are the latest development, and I think I will stop here with the time limitation. If you do have any questions, please send by chat, or if we don't have time, then we can answer your question later on. Thank you very much.